Well, thank you for joining us for this video on how to optimize outcomes with Xiaflex injections. By way of background, we've now done several thousand Xiaflex injections, and the goal of this video is to pass along many of the things that we've learned over time to help others get as much out of Xiaflex injections as possible. Now, although my initial impression of Xiaflex was very mixed when it first came out, after gaining some experience, I've realized that when done properly, Xiaflex is an excellent first-line option with good outcomes in the majority of men and very few long-term side effects. So the target audience for this video is both providers who administer Xiaflex, as well as patients who are considering Xiaflex, to make sure that you get the most out of the injections possible. Now, this is particularly important as you likely only have one chance to receive or administer Xiaflex appropriately, since repeat series or additional injections are often much less successful than the first set of 8 injections. Now, in this video, we'll review the various topics that you can see on the screen. All that said, this video should not be interpreted as specific medical advice for any one individual, but rather good general principles for administering Xiaflex. Step 1, finding the right provider. We found that particularly recently, there are many providers doing Xiaflex injections who have little or no training or experience with Peyronie's disease at all. This is the most common reason for patients achieving poor outcomes with Xiaflex, including having to pay significant amounts out of pocket or having avoidable complications such as unnecessary surgery. To find an experienced provider, look for someone who's done a fellowship training in andrology, is a current member of the SMSNA, has performed at least several hundred Xiaflex injections, and be a little wary of the Find a Provider tool on things like the Xiaflex website, as the far majority of providers listed there have very limited experience and no specialized andrology training. In fact, anyone who's done an injection can be listed there, and if you've done 20 injections in 12 months, you're listed as a high-volume injector. That means you only have to treat 3 men in the past year, and you're considered a high-volume injector on that site. Step 2. Have a penile ultrasound performed. A penile ultrasound is helpful in men considering Xiaflex, since we've previously shown in some of our research that the extent of calcification is directly linked to the extent of curvature improvements. Penile ultrasound is also recommended in the AUA guidelines for Peyronie's disease. Additionally, if your provider does not perform penile ultrasounds, this is somewhat of a red flag, since he or she may not be very experienced in treating and managing Peyronie's disease overall. Step 3. Inducing an erection helps to know where to inject. This is one key thing that has helped us to achieve more consistent outcomes in men receiving Xiaflex. Early on, we injected based on feel, by ultrasound guidance, or measurements of where the curve was located. However, we found in many cases, after a few injections, you can no longer even feel the plaque. Also, the maximal curvature doesn't always correlate with where the plaque is located. In some cases, we found that the curve moves fairly significantly during the course of injections. This all means that unless an erection is created prior to each Xiaflex injection, the medicine is likely being injected in the wrong location and is wasted. So now we give a medicine to cause an erection each time before doing Xiaflex injections to make sure that we're placing the medicine exactly where it needs to go. Step 4, performing the injection. Now, the injection itself is placed at the point of maximal curvature. This often corresponds where the plaque is located. However, that is not always the case. Regardless of where the plaque is, we place the medicine where the penis is most tethered, and we found this to be the most successful overall. Now, the medicine is slowly instilled in multiple areas rather than fully deposited into only one location. In the animation, you can see that the needle is withdrawn with a little bit of medicine administered over a larger area to optimize its efficacy. Step 5. Stretching is the key to success. Now, injecting the Xiaflex in the correct location is only the first step to getting a successful outcome. But if that's all you do, you won't see any improvements. Specifically, in one of the early studies of Xiaflex, if men received the injection but did not do aggressive stretching by hand, they had no improvements. So we generally recommend that men pull the penis straight out for 30 seconds, as well as perform counterbending for 30 seconds every time they urinate. We recommend starting these stretches the same day as the Xiaflex injection and continuing until at least 6 weeks after the final series. We also recommend using quite a bit of force with pulling, meaning about 10 pounds or the equivalent of a gallon of milk. Often, when we hear about failures, it's because the patient was recommended to avoid stretching until at least a week or more after Xiaflex injections, or to use very gentle traction. In my opinion, that is a complete waste, since the key time when curvature improvements can be achieved is during that first week after injection. In addition to the hand stretching, we recommend that patients perform stretching using the RestoreX device. Now please understand that we're a little biased in that regard since I helped to invent the device. However, early on in our time at Mayo, we compared outcomes of men who received Xiaflex alone, Xiaflex and any other traction device, or Xiaflex and RestoreX, and found that those who used Xiaflex and RestoreX had nearly twice as good outcomes as the other groups. Interestingly, when men used any other traction device, we didn't see any added improvements. Step 6, wrapping. Another key point to achieving good outcomes is making sure to wrap the penis for about 5 days after the most recent injection. This is done to minimize the amount of bruising, including blood blisters or hematomas or other types of bruising. Now when patients get real severe bruising, they're just much less likely to perform the necessary stretching to be able to straighten out the penis. The wrapping should be firm and include the whole penis, and it should not be removed for any reason except to urinate or to perform stretching. It should even be worn in the shower, as the heat often leads to worsening of the bruising. Step 7, optimizing comfort. Beyond just the injection technique itself, it's very important to make injections as comfortable as possible for patients. Otherwise, if the experience is painful, many men will skip future injections, and hence they won't get as much out of the overall treatment as they would otherwise. To do this, we typically perform a penile block using numbing medication, and this results in a significant reduction in any pain, and in many cases eliminates the pain altogether. We additionally offer laughing gas or nitrous oxide to patients to further minimize discomfort. We found that these two options have greatly reduced any discomfort that patients might otherwise feel, and it makes it more likely they'll continue with the full treatment course overall. Step 8, keep going. Some patients get discouraged if they haven't seen significant improvements after 1 or 2 series. In our experience, we found that only about 50% of patients will have noticed any improvements after the first series, whereas that number jumps up to 85% or more by the 3rd series. Similarly, of men who had very little improvements after 2 series, the far majority of those men went on to experience a 20% or greater improvement with the 3rd and 4th series. Now, I'm not sure why this is. I'm not sure if it's because these men start to learn how much they need to pull to get improvements, or if the plaque itself requires a certain amount of dissolution before it gives way, or what the case is. But later improvements are definitely not uncommon. Step 9, costs. Now, one of the concerns with Xiaflex is the potential costs of the injection. And this is where it's very helpful to be treated at a clinic that has a dedicated person who helps with the finances. Now, as an example, in our clinic we have an individual who will do all of the insurance checking, and that includes prior authorizations and appeals. Additionally, she submits reimbursement and grant applications in behalf of patients so they don't miss out on important and helpful subsidies. Now, because of her efforts, most men who undergo Xiaflex will have relatively minimal out-of-pocket expenses. But at a minimum, you want to have a very clear idea of how much the treatment course will cost you so you don't go into any treatment without having your eyes wide open. Step 10, management of complications. The final key point to mention is how to manage Xiaflex complications. Now, often the complication that patients worry most about is the possibility of a penile fracture. However, in our experience, we found that the goal of treatment is actually to cause small, controlled fractures, and that these are actually a very good sign of long-term outcomes. After all, the treatment itself is designed to dissolve the plaque so that the plaque gives way and allows for straightening. However, we found that inexperienced providers are often very quick to rush patients to surgery who've had suspected fractures. This then results in recurrence of curvature, disappointed patients, added costs, and basically starting over at square one. In contrast, in our experience, we had always managed these very conservatively with penile wrapping and without going to surgery. Now, at one point, we sent a survey to all men that we'd treated who had suspected fractures and were just observed without surgery. Our data showed that these men did not have any higher rate of erectile dysfunction or other long-term complications compared to those who did not have a suspected fracture. Most surprisingly, though, they actually ended up with a better overall curvature correction. Now, this is not to say that no one should have surgery for suspected fracture, but this is an area where having a truly experienced Xiaflex injector will be really important, as you don't ever want to undergo an unnecessary surgery if it can be avoided. And in our experience, we do not routinely recommend performing surgery in cases like this, except in very, very rare circumstances. Well, I hope this video has been a helpful resource for you. If you have any questions after watching the video, please feel free to visit our website at peyronies.com or email us at email@mfp.clinic. Thank you very much.